How many of you have been told that your thyroid is fine, but you're still struggling with symptoms that seem like hypothyroidism? Maybe you've got brain fog, maybe you're still gaining weight, or you have constipation. I'm here to talk about why your doctor may not know what thyroid labs to look for, and even if they do know what to look for, why they may seem normal to your doctor when in fact they're actually out of range. Welcome back to Dr. Britnei, your other doctor channel, where I help you get to the root cause of your dis-ease so that you can start feeling better. Let's get started. You've been told that your thyroid looks fine, but you don't feel fine. TSH is just a piece of the story, and this could be why your doctors are telling you that your labs are normal, but you still feel like you're experiencing hypothyroid symptoms. TSH is actually just a signal from the brain. TSH stands for thyroid stimulating hormone, and it does exactly what it sounds like it does. It stimulates your thyroid to produce thyroid hormone. So TSH in and of itself is actually not a thyroid hormone. If it's the only one that your doctor is testing for, that may not be their fault. If they're not a specialist, they probably don't know that this is not the best indication of whether your thyroid is functioning properly. And it certainly isn't an indication of whether you have adequate levels of active thyroid hormone. TSH also can't tell you whether you have an autoimmune condition like Hashimoto's or another type of autoimmunity where you have positive thyroglobulin antibodies, which we'll talk about later. What tests are you supposed to be running to make sure that you have a full picture of what's going on in your body and how your thyroid is communicating with your brain? So if your TSH is normal, how is it possible that you could still be feeling hypothyroid? Let's talk about what a full panel looks like and what the entire feedback loop from your brain out to all of the tissues of your body and back to your brain really looks like. We'll go through each one of these tests, talk about what to look for in terms of ranges, and how each one along the way communicates with itself. We will talk about every single one of these tests along the feedback loop and what ranges to look for to make sure that we are doing a full evaluation of your thyroid and of your hypothyroid symptoms. Speaking of thyroid testing, I've actually created a free guide that goes through all of the tests your doctor should be testing for, the ranges they should be looking out for, so that you can advocate for yourself, even if you're only with, say, your primary care physician or perhaps an endocrinologist who isn't fully seeing the picture. Go ahead and download the guide now. A TSH test or thyroid stimulating test is not enough to get the full picture of what's happening with your thyroid. What do we have to look for along the feedback loop to make sure that you're being well cared for? So first we start with TSH. TSH, thyroid stimulating hormone, comes from your pituitary gland, which is in your brain. TSH levels actually don't matter. I know that seems kind of mind-blowing, and I'm sure most of your physicians would say TSH absolutely matters. But TSH levels will go up and down depending on active thyroid hormone levels in circulation. So what matters more is how much active thyroid hormone do I have, and not necessarily how your brain is reacting to those levels of thyroid hormone. Your TSH levels will go up and down even throughout the day to make sure that you have enough T3 hormone in your body to maintain metabolic function. We do care about TSH because it can tell us whether you have a pituitary problem, but that is really, really rare. So you should never have a physician who is managing your dosing or your testing or your diagnoses just based off of a TSH level. I have patients with wildly high TSH levels who have perfectly normal hormone levels, and I have patients with really low TSH levels that also have perfectly normal hormone levels. It's just not a good indication of how well your thyroid is functioning. So once we look at TSH, where are we supposed to go from there to make sure that we're doing a really deep dive into your feedback loop? Where I like to start next is with something called free T4 or thyroxine. When we say free versus total, what we're talking about is how much active hormone is available versus how much hormone has been inactivated by being bound to a protein in your body. We want to look at free T4 because that really tells us how much of that thyroxine is available to be converted over into T3, which is your active thyroid hormone. So free T4 levels, again, can actually fluctuate. Kind of like TSH, a free T4 level is not the only marker or indication of whether your thyroid is functioning well, especially since so many things have to happen in order to convert that T4 into T3, which is the only active thyroid hormone that you have. We want to look at free T4 because it tells us whether your thyroid is producing T4, and we want to make sure that you have enough of that. But what really matters is what's that conversion rate. So for example, if your free T4 is, say, somewhere between a 1.0 and 2.0, those could be pretty normal ranges for any individual. Then we want to look at your T3 levels, and we want to see, are we getting a one-to-one conversion of those two hormones? There are things that can block that conversion, like nutrient deficiencies, which oftentimes happen due to malabsorption in your gut. Other things that can block that conversion of happening is high stress. So we always want to test for something called reverse T3 when we're evaluating the conversion of T4 to T3. Your body will convert a lot of its T4 into reverse T3 when you're in a very high stress state. That's because T3 is very metabolically active, kind of ramps up your system and your metabolism. And if your system and metabolism are already ramped up due to maybe an adrenaline response or high cortisol, your body is going to start to kind of inactivate that T3. And one of the ways that it does that is it converts T4 into reverse T3. So if you're seeing an elevated reverse T3 on your labs, that is almost always a sign of chronic stress. And it doesn't mean that you don't have enough thyroid hormone. It means that we have to calm that stress response down so that your body can start actually using the thyroid hormone that it already has. So to evaluate how much T3 you have in your body, we actually want to look at total T3. The reason for that is because free T3 is inside of the cells that it is activating. You cannot test for a hormone that's inside a cell that's inside of an organ. It's not floating around in your bloodstream. The other issue here is that every organ takes up T3 and converts it into free T3 at a different rate. So all different organs in your body require different levels of free T3. You just can't test for it in blood. So instead, we get around this by testing for total T3. Total T3 lets us know how much do you have in circulation, how much is available to be taken up by these cells in your organs. We can also test for something called T3 uptake. T3 uptake tells us how many of these receptors are available for binding. There are things that can affect your T3 uptake, things like high estrogen or estrogen dominance, which oftentimes comes with insulin resistance. This can actually weakly bind to T3 receptors, decrease your T3 uptake, and even though you may have plenty of T3 hormone, it feels like you're hypothyroid because something is blocking that receptor. Same thing happens to a lesser extent with reverse T3. So you can see how different states in the body, different dis-ease in the body can very much make it feel like you're hypothyroid, even though you have enough thyroid hormone. If your physician doesn't understand these feedback loops, then they may not believe you when you're telling them, I don't feel well. The next step in this process is arguably one of the most important, and that is to make sure we are evaluating you properly for autoimmune thyroid disorders. Autoimmune thyroid disorders are mutually exclusive from hypothyroidism. You do not have to have a thyroid disorder like Hashimoto's in order to have hypothyroidism. And just because you're hypothyroid doesn't mean that you have Hashimoto's. And Hashimoto's is not the only thyroid disease that we're talking about when we're talking about autoimmunity. So we have Hashimoto's. Let's talk about that. Hashimoto's means that you have positive thyroid peroxidase antibodies. And your doctor may have missed this as well if they're only going off of lab reference ranges. I say this in all of my videos, but lab reference ranges are not normal ranges. I'm going to say it until you guys get it. Lab reference ranges are averages that the lab comes up with that are based on the people going into the lab. If they're people like you who don't feel well, you're throwing off the algorithm, right? So when we're looking at labs, we want to look at them from a functional perspective. If I was to look this up in an endocrinology journal, what would this value be for a normal and healthy individual? So when we're talking about thyroid peroxidase antibodies, the cutoff is actually 9. LabCorp will have you think it's 34. Other labs think it's anything over 2. So you can see there's a lot of discrepancy and a lot of room for interpretation. Most of the patients that we treat, about 85% of them have Hashimoto's. And we know that if you have positive thyroid peroxidase antibodies over a 9, that is a positive value. This means that your body is creating antibodies against an enzyme called thyroid peroxidase. What does thyroid peroxidase do? It actually removes an iodine molecule from T4, which has 4 iodine molecules, and puts it into T3, which now only has 3 iodine molecules. So thyroid peroxidase, in other words, activates your thyroid hormone. Thyroid peroxidase antibodies will disrupt this process. So again, you can feel very hypothyroid if you're flaring these antibodies and constantly blocking this process. And that may not actually be an insufficiency of hormone. What that really is that you're triggering an autoimmune response that's destroying active thyroid hormone. And if we can reduce that autoimmune response, it's pretty likely that you won't have to be on any kind of thyroid hormone replacement. Now, that doesn't apply to everyone. It really depends on where you are in your disease process. If you've had uncontrolled, unmanaged Hashimoto's disease for a long period of time, you may have destroyed enough thyroid tissue that there is no hope of getting that hormone back online without giving you a replacement. But again, that involves a whole lot of looking into every single part of this feedback loop before we decide whether or not you need to be on a medication. The other type of autoimmunity that we want to look for in every patient that's complaining of fatigue and brain fog and constipation and weight gain is going to be something called thyroglobulin antibodies. So we talked a lot about the difference between free and total hormones. Well, total hormones, total thyroid hormones, are carried around by a protein called thyroglobulin. You can actually create an antibody. Your immune system can destroy the protein that's carrying your thyroid hormone around. So again, this is not an issue with you not producing enough hormone. This is an issue with your immune system destroying the hormone that you already have. That can start to lead to hypothyroid symptoms, even though on your thyroid hormone blood work, it doesn't necessarily look like you are hypothyroid. Treating autoimmunity and treating hormone deficiency are two different things. It is wrong to assume that just because you have Hashimoto's or positive thyroglobulin antibodies, you are hypothyroid. And vice versa. It's wrong to assume that just because you're hypothyroid, you have some kind of autoimmune condition. One of the last steps in this process is we have to consider how many nutrients are involved in the conversion of T4 to T3, or in general, just the creation of thyroid hormones. Everyone thinks iodine, iodine, iodine. And of course, iodine is very important. We just talked about how T4 has 4 iodine molecules and T3 has 3 iodine molecules. Of course, we need iodine. However, in patients who have thyroid peroxidase antibodies, if the whole job of thyroid peroxidase is to target this iodine molecule, and you've got an overactive immune response against this enzyme, if you take high doses of iodine, you're going to throw yourself into a flare. You have to be so careful careful about the supplements that you add into your regimen. You should not be taking more than 100 micrograms of iodine in a supplement. And to be honest, most of the time, I don't include it at all. You should just be able to get enough through your diet. Other nutrients that are important for thyroid hormone conversion are going to be selenium and vitamin D. And these are things, again, we can get through our diet, but they also require proper absorption in your gut. So if you have any kind of inflammation in your GI tract, if you have food sensitivities, if you have chronic stress, if you have low thyroid hormone, you can have really poor absorption in your gut. Sometimes it's a chicken or the egg situation. Sometimes I have to temporarily give a bioidentical thyroid hormone to repair the gut so that we can get absorption of these nutrients, so that we can have enough active thyroid hormone in our body. And there's a way to do that, and that way we can actually come off of those medications as long as we are properly monitoring. Many doctors refuse to order the gamut of tests that are required to properly evaluate your thyroid. So what can you do in that case? Well, first of all, you can download my free guide, and that will give you all of the testing that you need to bring to your physician to say, hey, listen, here's what these hormones do. Here's why I think they're important. If they still don't take you seriously, there are labs like directlabs.com where you can actually order this test on your own. Cyrex also offers a panel with most of these labs as well. I would, however, highly encourage you guys to reach out to a specialist, someone who really knows what they're talking about. And honestly, if your doctor refuses to run lab work that you're asking for, just remember, they work for you. Get rid of them and find a better doctor. If all else fails and you're kind of stuck in the insurance system and you've got to stick with the doctor that you have, track your symptoms. That's one of the easiest things that you can do to say, hey doc, I don't feel well. I have these symptoms. Here is real data on how I've been feeling. It's not all in my head. I don't want an SSRI. Why don't you just give it a shot and listen to me? Advocate for yourself as much as you possibly can with real research-backed evidence that you can bring to them. Again, most of this is offered through my free guide. The right tests equals the right treatment equals the right results for you. Have you ever been told that your thyroid is fine, but you still feel awful? Drop a comment below. I read every single one of them, and I would love to talk to you. Now that you know how standard thyroid testing can be incomplete, I want you to understand how gluten can be stopping you from getting into remission with your Hashimoto's. Click the video on your screen now, and I will see you there.